Hello, my name is Brad Gus, and I wanted to take a moment to talk about my ADD. As a child, I had great impulsivity, lack of focus at times, and at times when I tried to focus, I found it very difficult to do so and found myself having to work probably 2 or 3 times harder than other people in my same class. I was diagnosed with ADD when I started working with Jeff Gaisley, and we diagnosed it by the Almond questionnaire test, and it assessed that I had overfocused ADD, which is more of the worrywart type of ADD. It includes the classical ADD, which is the lack of stimulation in the prefrontal cortex, but also includes dramatic inflammation of the cingulate system and the basal ganglia. So at a point we then went to the Almond Clinic to go ahead and see what my brain looked like, and the first scan we did was without medications, and you can see from the 3D scan that the deep pockets are where the lack of dopamine and stimulation would be in that prefrontal cortex. The next scan was done with taking 3 of the AdCare supplement, and you can see that the left prefrontal cortex looks very normal, and there's just a minor bit of the right prefrontal cortex that didn't get fully filled in. As you look at the last 3D scan is with an amphetamine-based stimulant, Adderall, where it shows that both the right and left prefrontal cortex are filled in. So with the AdCare, I saw about 90% activity in the prefrontal cortex relative to the Adderall. So now as we look at the first deep image scan without medication, we can see that towards the bottom of the picture that there's no white, which means that there's no dopamine being created by the cerebellum. As we look at the top part of the brain, where we see some white going on, that is very characteristic of my type of ADD, which has anxiety disorder type of activity going on. And so we start to see that whiteness, which means the brain's working about 15% more than it should. As we look at the second scan, which is with 3 of the AdCare supplements, in the bottom of the picture we start to see some white activity, which means that dopamine's being created. And as we look at the top, we can see that the cingulate system is totally cleared, there's no white, and there's a dramatic reduction in the white activity in the basal ganglia. Again, the basal ganglia really indicative of anxiety or worrisome, those types of feelings. As we look at the third deep scan, which is with the Adderall, which is the amphetamine-based stimulant, we see more white at the bottom, which means more dopamine is being created. However, we also see a re-inflammation of the cingulate and the basal ganglia system. You can see a lot of white at the top and on the sides towards the top. That's really inflamed, again, driving anxiety and worrisome. And I must admit that during those scans I was having anxiety attacks. So that's very, very characteristic of my type of ADD. And initially, before seeing Jeff, I was initially diagnosed with an anxiety disorder, but not with the ADD. When I started to then, after being diagnosed with ADD and starting to take medication, the anxiety that I was having, primarily associated with flying on an airplane, was dramatically reduced, as was in other areas of my life, riding in the back of a bus, any kind of crowded area. All these types of things triggered for me claustrophobia, which kicked in the anxiety and the worry, and my overfocused ADD went into overdrive at those moments. So, but with the AdCare, I notice a very, very good stimulation of my prefrontal cortex. I also noticed that I'm also a lot calmer than I was on Adderall, and we could really link that up with that third deep scan where you saw the really A lot of activity going on in that cingulate system and the basal ganglia. The third item that we did at the Almond Clinic was the Conners test. The Conners test measures performance in terms of, is a person very impulsive? Are they very erratic? Really helps to diagnose ADD type of symptoms. Without medication, I missed 9 out of 10, which indicates a very high impulsivity disorder. Very, very common with classical ADD and my type of ADD, which is the overfocused ADD. With the AdCare, I missed 0 out of 10, which is normal performance. With the Adderall, I missed 0 out of 10, which indicates normal performance. So we can see that the AdCare tied the Adderall for performance of what a normal person would experience. The other thing in meeting with the physician that helped to discuss the results, Dr. Larry Mamaya, was very impressed with the AdCare in how it showed very good stimulation of the prefrontal cortex. It showed from those deep scans a very good amount of dopamine being created towards the bottom, a lot of white there. He was very impressed with the basal ganglia and the cingulate systems being reduced in activity. And he also said that there are wonderful health benefits of not being on Adderall, and that the AdCare would be a much safer long-term solution, which was very, very appealing to me. So again, if you want to find out more information, please visit the website www.add-care.com. Thank you for your time. Have a great day.